series in fundamentals. The reason for this is because a lot of people have asked me, and there is just a lot to know when you're given a book like this big, and it's honestly no time to read it, and you just have to know a lot. So this is going to be the first video, and every few days I'm going to be posting another fundamentals video until we're done the series. So let's get started. The first thing we're going to be talking about today is the nursing process. The nursing process has the mnemonic of ADPIE. So ADPPIE. And that stands for assessment, diagnosis. The first P stands for planning outcomes, planning interventions, implementations, and evaluations. That's 6. There's 6 phases. So let's go over briefly what they are, so you have like a quick picture, and then we're going to go over in depth of what each one is. So assessment is basically your assessment of the patient. The patient comes in, they're short of breath. So they're going to tell you one thing. That's going to be subjective data. They're going to tell you, I'm short of breath. And you're going to look at them. And then you're going to do your physical assessment. Are they short of breath? Are they labored breathing? Retractions? Are they breathing through their mouth? Are they having trouble talking? Or maybe not. Maybe they're just talking perfectly fine on a phone and they say they're short of breath. So that's going to be, the subjective data is going to be what the patient tells you. Objective data is going to be what you see and your physical examination of them. Then we go on to diagnosis. This is going to be based on the data you collected. So based on the assessment, you're going to make a diagnosis. What do you think they have? Then you're going to plan the outcomes. That's pretty straightforward. You're going to plan the interventions. So anything to do to help the patient achieve their goal. Then we have implementation, is you actually carrying out that task, carrying out the interventions that you're going to do. And evaluations, were the outcomes achieved? If yes, good, continue with it. If not, how could we improve and be successful? So now let's go through every single one, like in depth. So first we start off with assessment. Assessment is your first thing you're going to be doing. Number one, you want to have a therapeutic relationship with the patient, so that they could feel open and tell you the truth. Like, let's just say I was smoking weed or something, not that they feel scared or anything to tell you. So you want to have a therapeutic relationship that they trust you. Then there are different features of assessment. First, you start off with collecting the data. So that's your health history. You're asking the patient their past medical history, and that's your physical examination. And then you validate the data. By validating the data, I'll tell you what that means. Basically, you have your subjective and objective data. Like we just said before, subjective is what the patient's telling you. Objective is what you see of the patient. And a lot of times that do not coincide. So like in the example before, someone comes in, I'm so short of breath, but they're talking on their phone to their best friend, laughing and giggling, having no problem talking. So the subjective data is not going inside with the objective data. They conflict. So in that case, you'd want to validate your data because it's inconsistent. And then after you validate the data, then you want to organize, put it like into different groups. So for instance, putting the main category, is it spiritual problem? Is it physical, mental, psychological, etc.? And then you want to record the data, which is document. There are different types of assessment. That's what we're going to be talking about now. Number one is your initial assessment. So your patient comes in the first time. It's like admission, they come in the first time, you're asking them all the questions, their past medical history, their mother, their father, etc. Then we have the ongoing assessment. That's as needed, or anytime you're in contact with the patient after the first assessment. So they come in for a follow-up. Let's say the first time they came in, they were a new patient. Now they're following up for something that they came in for. So you don't have to do a whole initial assessment. You know them already. But you're just following up, so it's an ongoing assessment. Then we go to a focus assessment. A focus assessment is on a specific body part. So for instance, someone comes in with ear pain, like the kid is tugging on their ear, so you think like an ear infection, right? But why are you going to ask them how many times they're peeing a day, or if they have trouble going to the bathroom? That has nothing to do, like you're doing a focus assessment. So generally, if someone would be tugging on their ear, you would be doing like HENT, so head, ears, nose, throat, etc. Then under focus assessment, we have special needs assessment. So that's like a specific area. So for instance, like a woman comes into a prenatal clinic or something like that. So those are all the different type of assessments. And now we go on to diagnosis. So we just did A, now we're going to D. So assessment, and we're going to diagnosis. Diagnosis, you always want to use your critical thinking skills for that. For diagnosis, there's a medical diagnosis, which we don't do, and there's a nursing diagnosis, which is nursing, so we do that. The nursing diagnosis is something that has to be taken from NADNA. NADNA, they have over 200 diagnoses, and you have to take your diagnosis from them. So you can't just make up worried about whatever. It has to be from them and in their format. So we're going to go through how to do it. And the reason for making a diagnosis like a nursing diagnosis is to be able to make your interventions based on that. So a medical diagnosis identifies a disease or pathology. And the reason why they do that is to cure it, to treat it. An example, a myocardial infarction would be a medical diagnosis. That's a heart attack. And you identify that in order to cure the myocardial infarction, to stop it from not getting oxygen. So the nursing diagnosis would be to identify a patient's response to the medical diagnosis. So the medical diagnosis is identifying the disease or pathology, let's just say myocardial infarction or hypertension. And then the nursing diagnosis is what's the patient's response in response to the myocardial infarction, in response to the hypertension. So for your hypertension patient, patient needs dietary changes in relationship to the hypertension, because they can't have a lot of salt then. So something like that. And you have to get it from the NADNA. You can't just make it up. Before we go into how to write the nursing diagnosis, you have to know what type of nursing diagnosis it is. There are 3 different types. You have your actual, which is a problem focus. So what's actually happening? Like, what's the problem that's present? For instance, ineffective breathing pattern. For your patient who's short of breath, so you're not going to write short of breath, you're going to write ineffective breathing pattern. Then you have your potential diagnosis, which is like the risks. So at risk for X, Y, and Z. So your old patient, at risk for falling, or at risk for infection for someone who's a cancer patient. Something like that. Then you have your wellness. So this is a health promotion. So this is going to be like readiness for enhanced family coping, something like that. And they're pretty distinct, so it's pretty easy to know which category to put yours into. Now, based on that, you're going to format your nursing diagnosis. And so we're going to start with the actual. And the actual, like we said, is the problem focused. So that's going to be 2 or 3 parts. The first one is 2 parts. So 1, 2. It's going to be blank related to blank. And the blanks you're going to fill in is the nursing diagnosis related to sign and symptom. So for your nursing diagnosis, let's just say anxiety related to increased heart rate. That would be your nursing diagnosis related to the sign and symptoms, increased heart rate. The 3 part is the same thing, you just add by as evidenced by. So you're going to add as evidenced by. For instance, nursing diagnosis related to sign and symptoms as evidenced by. So in that same one, you're going to do nursing diagnosis, which is anxiety related to increased heart rate as evidenced by a heart rate of 130. So that would be that. Then we go on to our risk. Our risk is 2 parts. It's going to be risk for blank related to blank. So the risk for is going to be, what are they at risk for? Pressure ulcers, activity intolerance, related to, so that's going to be your sign and symptoms or your risk factor. What makes them at risk for that? So risk for pressure ulcers related to immobility, or risk for activity intolerance related to unable to walk on the leg, something like that. And then you go on to your health promotion, your wellness one, and that is 1 part. So that's going to be readiness for enhanced blank. Readiness for enhanced family coping, health maintenance, etc. You just take it from the NADNA list. Now we go on to planning outcomes and interventions. So you have the initial planning, the ongoing planning, and the discharge planning. Initial planning begins when you first contact the patient. You're making your whole initial comprehensive plan. Ongoing planning is you're going to have to tweak it. You make this whole good plan, the patient doesn't do anything, you got to tweak it. Or the patient's doing everything, you have to add on more. You did not think they would do that well, like that. And then the discharge planning, that actually begins at the assessment, the first thing you see the patient. And the whole thing is the process of planning, because the whole point of you with a patient is the process of planning, and they could be able to do this on their own and be discharged out of your care. So stuff that they would need at home to help them, be alone, because they're not going to be in the hospital or wherever you are for the rest of their life. So you need to do the discharge planning, like what they need and everything else like that. Basically, when you're making a nursing care plan, you want it to be goal-oriented. It has to be specific and goal-oriented. It shouldn't just be like the same thing for everybody. Okay, so in terms of the planning outcomes, like we're talking about, you have your goal. Your goal is like a broad statement. Describe like the desired things that you want to see in your patient being successful. Every nursing diagnosis, you need to have at least one goal. And then, so that was the goal. And then for the interventions, it's basically what are you going to do to achieve that goal. So your goal is to prevent ulcers. What's your goal? How are you going to do that? Your interventions could be, you're going to turn the patient every 2 hours. Interventions are going to be, you're going to apply a Mepilex dressing. Interventions, like that's going to be certain stuff that you're going to do to prevent your goal, to make your goal from happening. So the nursing intervention should be directed by the patient's problem, should be linked to an evidence-based practice, and should be clear, specific, precise, and established priorities. With interventions, we have direct and indirect interventions. So direct intervention is stuff you do with the patient. So we're going to walk a few steps. Indirect interventions are stuff that you do on behalf of the patient. You're going to advocate for them. You're going to do all stuff on behalf of them. Okay, so in terms of writing a goal statement, you want it to have the patient, so the subject is the patient will. You have an action verb is, be clear in that. So it's going to be like where, the patient will walk, where, talk, whatever the action is. Performance criteria should be specific and measurable. So the patient will wear a leg brace, for instance, and you want to write the target time. So the patient will wear a leg brace from 5 a.m. to 10 p.m. daily. So, and then you also could write in like specific conditions, assisting with ambulation, whatever they need. So components of a goal statement include subject, which is the patient usually, action verb, what are they going to do, walk, talk, etc. Performance criteria, what is it? The leg brace. They're going to wear the leg brace, walk, whatever. Target time, when are they doing this? Every morning from this time to this time, every day for 5 days, whatever they're doing. And then you could add on your special conditions. When selecting a nursing intervention, obviously we're going to do it based on the goal. So whatever the goals are, we're going to have nursing interventions based on that. You want to review the nursing diagnosis. You want to review the goals, obviously. Select the intervention based on that. And you always want to write a rationale. Why did you choose that? You can't just be like, I'm going to turn the patient. You have to write a rationale. Why are you going to turn the patient? To show why, or like how that has to do with the goal and how that's going to help you achieve the goal. Component of a nursing intervention is kind of like the components of a goal also. You're going to have the date. So you're going to have the date. You're going to have the subject, so that's the patient. Action verb, what are they going to do? Walk or whatever. Time and limit, so walk, 5 steps from 5 a.m. to whatever, 5 days a week or whatever it is. And you want to sign your order, because basically it's kind of like committing you to do it. It's like a morally, ethically thing to do. So now we go on to the next step in the nursing process, which is implementation. Implementation is when you are actually carrying out the intervention. So it's the action phase. And in this phase, you could always delegate. One thing I forgot to mention, you could never, as a nurse, you could never delegate assessment. But you could delegate action. So you could delegate an LPN to help you do stuff, to turn the patient, etc. But you can never delegate assessment. That has to be done by the nurse. So you want to document what you're doing. You want to document their response. Did they partially perform it? Did they fully perform it? Did they not do anything? Implementations, obviously it has to be something that you're qualified doing. You want to make time for this and put in your schedule, etc. So next we go on to evaluation. With evaluation, you have first up, you're going to examine the results according to the data that you collected, etc. You're going to compare your results to what you planned for the patient. you're going to recognize the errors that you did, that you told that you said you're going to do this and it was way too far off, or etc., whatever your errors were. And you're going to understand the patient better and what they're capable of doing and how you need to tweak anything. So basically, evaluation is whatever happened, you're looking at what happened and you're comparing it to your nursing care plan. Were the goals appropriate? Do I need to tweak it? Do I need to make it too much harder? Do I make it easier? Do we need to make it more time to do that? So with evaluation, you're going to come to 3 conclusions. Number 1, the goal is going to be met. Perfect. Check off. Patient sent home. You're great. Number 2, the goal was partially met. So if that's the case, you're going to basically go through it and decide if you need to give the patient more time to complete the goal, or do you need to change the goal because the last part is not, they can't get it, etc. And the last thing, the goal was not met at all. So if that, you're going to reevaluate everything that you wrote, and you're going to have to revise the whole entire plan. Or you could start from another whole plan, but basically nothing was met. That's it for this video. That is part 1 of the fundamental series, and we went over the whole nursing process in detail. It's very important to know, and stay tuned for the next nursing fundamental video. Please like, subscribe, stay tuned to this channel, and let me know if you have any questions or comments. Bye.